Hi, this is Brandy Babin. I am at Mana Health Partners bringing you another educational series, this time on MIPS, which is Merit-Based Incentive Payment System. So MIPS is a combination of three past Medicare quality programs. One that was in 2017 for physician quality reporting system. The other one was based on value, and the other one was based on electronic health records. So they took these three programs that Medicare kept trying to put into place and they put it into a MIPS. So this is improvement activities, things that actually improve the quality of care that we perform for the patients. And it accounts for 15% of total performance score. So where does the LCSW come into place? Well, the purpose of a MIPS is to encourage clinicians such as psychologists, LCSWs, and other healthcare providers to report on various quality measures related to patient care. Some of those areas include preventative care, advanced directives, depression identification, and suicidal monitoring, as well as patient safety and care coordination. So the first MIPS we chose was on advanced care planning. The MIPS states that patients age 65 and older who have an advanced care planning or a surrogate decision maker is documented in the medical record or documented that the advanced care plan was discussed. It doesn't mean the patient has to be a full code or a DNR. It just means that it was discussed. It is essential that the patient's wishes regarding medical treatment be established upon admission, assumption of care, as soon as possible, so that if the patient does become incapacitated, we do know what their wishes are. So in order to meet the criteria for this MIPS, you're going to have an advanced care planning discussion documented and either a surrogate decision maker documented in the record or that advanced care planning that do not resuscitate. So performance is also met by advanced care planning discussed and documented in the medical record. The patient did not wish or was not able to name a surrogate decision maker or provide an advanced care planning. So we asked them, we discussed it, we documented on it, but they didn't name anyone and they hadn't made their decision on whether they wanted to be a full code or not. Performance not met means that there's no advanced care planning that was documented, and there's no reason why. Not that the patient was comatose or unresponsive or had aphasia, but that we just didn't do the discussion and we didn't document why we didn't do the discussion. Depression screening and follow-up planning was another MIPS that we chose, and the rationale behind that. So MIPS states that patients age 12 and older be screened for depression on the date of encounter or up to 14 days prior to the date of encounter. So you could do a PHQ-9 or you could do a depression screening up to 14 days before you see the patient using a standardized tool. That's the key word, standardized tool. And if it is positive, a follow-up plan is documented on that date or at least 2 days after the encounter. The follow-up plan must be related to a positive depression screening. So for example, patient referred for psychiatric evaluation due to positive depression screening, and then there must be a follow-up plan. So a referral to a provider, pharmacology interventions, or any other interventions or follow-up for the treatment of depression. So in order for that MIPS to be met, you're going to have screening for depression, and if it's positive, you're going to have a follow-up plan within 2 days. If the screening was negative, then a follow-up plan isn't required. An exception would be the screening for depression is not completed, and there's a reason why. You can write no depression screening obtained related to patient's cognition or related to aphasia or related to comatose. Performance is not met if the depression screen wasn't documented and then there's a reason not given. Or if the depression was documented as positive and then there's no follow-up and no reason why there's no follow-up. So here's just some basic, we said had to have a official score, a screening tool. So here's some official screening tools for depression. You've got some adolescent screening tools. You've got some perinatal screening tools. I put in red in the middle the adult screening tools. So it doesn't have to be a PHQ-9. It could be any of the others, which are official screening tools for depression. The other MIPS we chose was depression in remission. So patients that are 12 to 17 years old or adult patients 18 years of age or older with major depression or dysthymia who reach remission within 12 months. Or the percentage of patients 12 to 17 or adult patients with major depression or dysthymia who reach remission 12 months, give or take 60 days after an index event. So performance met. Adult patients 18 or older with major depression who reach remission at 12 months as evidenced by a PHQ-9 or a PHQ-9M score of less than 5. We've met depression remission. Performance not met. Adult patients 18 years or older who did not reach remission by the PHQ-9 or the PHQ-9M score of less than 5, or it was not assessed, or the score was equal or greater to 9. The next MIPS we chose was alcohol use prevention, care, and screening. So prevention, or the percentage of patients age 18 and older who were screened for unhealthy alcohol use during systemic or systematic screening and method at least once in the last 12 months and received brief counseling if they were identified as an unhealthy alcohol user. The measure is also intended to reflect the quality of services provided for preventative screening for unhealthy alcohol use. There doesn't have to be a diagnosis associated with this. Alcohol use, alcohol abuse, alcohol encephalopathy. You don't need a diagnosis. The performance is met if you've identified an unhealthy alcohol user when screened using the systematic screening method who received brief counseling. The performance is also met if you've got unhealthy alcohol use and they were not identified as an unhealthy alcohol user. And the performance was not met if the patient was not screened. So if you didn't do the screening, you didn't meet the criteria for this MIPS. Unhealthy alcohol use, here's some screening tools. There's the audit C, there's the single question screening. So there's some screening tools that you could use. The next MIPS we used was the suicidal safety plan. It talks about patients aged 18 and older with suicidal ideations or behaviors by utilizing an assessment tool or a screening tool. And they're at increased suicide risk for whom a safety plan is initiated, reviewed, and or updated in collaboration between the patient and their clinician. So both need to be involved. The measure is used for mental and or substance abuse and suicidal thoughts, behaviors, or risk symptoms who are seen during that period of time. This measure is intended to reflect the quality of services for patients with suicidal ideations. Again, the suicidal safety plan needs to be initiated, reviewed, and updated within 24 hours, and then within 120 days after initiation, 4 months, you follow up. So to meet that performance, patients had a suicide safety plan initiated, reviewed, and updated, and In collaboration with the patient and their clinician, within 24 hours, a safety plan was arranged. Performance is not met if they did not have a safety plan initiated, reviewed, or updated for those patients that had suicidal ideations. The suicidal safety plan, this talks about numerous scales that you can use. The PHQ-9 is a depression scale, but they've got the potential for suicide risk, the severity for suicidal risks rating scale. So the next MIPS we chose was the reduction in suicidal ideation. So that's the percentage of patients 18 and older with mental or substance use disorder and suicidal thoughts, behaviors, or risk symptoms who demonstrated a reduction in suicidal ideations based on using the Columbia Suicide Severity Rating Scale or within the 120 days. So that performance is met if they have a reduction in suicidal ideations within that 120 days. And the performance is not met if you did not do the 120-day assessment, or if they didn't have a follow-up 120-day index. So they either have to have a reduction in their score and they have to have the assessment completed. If you have any questions, of course, you can call me, you can text me, you can email me. I'm here to assist in this. Sometimes MIPS aren't easy, but at the end of every assessment, you'll be able to see that you really made a difference answering those questions. It helps to remind you to do those assessments, and I think that you'll really enjoy doing the MIPS and getting in the habit of doing some of those assessment scales. So any questions, call. Otherwise, have a great day.